In this video, we'll be discussing the trachea and bronchi, exploring their anatomy, structure, and functional significance within the respiratory system. To do so, we will start with a brief introduction, followed by detailing the trachea's descriptive anatomy, anatomical relations and vascularization, innervation and lymphatic drainage system. Then the bronchi's descriptive anatomy, anatomical relations and vascularization, innervation and lymphatic drainage system. Some key clinical notes and applications. And finally a conclusion in order to summarize all the key points. The trachea and bronchi are cartilaginous and membranous airways designed to convey respiratory and phonatory airflow. Let's start by detailing the descriptive anatomy of the trachea. The trachea has two segments. A cervical segment, that follows the larynx, extending from the lower border of the cricoid cartilage, contained within the visceral sheath of the neck, and moves obliquely downward and backward in the subhyoid region, ending at the upper border of the manubrium sternum. And a thoracic segment, that occupies the upper part of the middle mediastinum, extending from T2 to T4, where it terminates by bifurcating into the two main stem bronchi. The trachea has the shape of a cylindrical tube flattened on its posterior surface. The anterior part is made up of overlapping, prominent cartilaginous rings, separated by interring depressions. The posterior part consists of a flat, flexible membrane. Its length is between 12 and 14 centimeters. 6 to 7 centimeters for the cervical segment. And 6 to 7 centimeters for the thoracic segment. And for the caliber of the trachea, it varies between 12 to 16 millimeters. The tracheal mucosa is white-pink in color. It's raised in the front by a series of folds corresponding to the tracheal cartilages. At the lower end of the trachea, the two bronchial orifices, right and left, are separated by an antero-posterior prominence, almost median, slightly displaced to the right, the carina, or tracheal spur. When it comes to its structure, the trachea, like the bronchi, is made up of two essential layers. An external layer, that is fibromusculocartilaginous, formed by the stacking of 15 to 20 cartilaginous pieces in the shape of a horseshoe, separated by interannular ligaments and joined at the back by a fibrous lamina. This is the membranous layer. This external layer is covered by an adventitia. And an internal layer, that is a mucosal layer consisting of a chorion that contains mucus glands and a characteristic epithelium. Concerning the means of fixation of the trachea, it varies from segment to segment. The cervical trachea is held in place by its continuity with the larynx, and its adhesion to the esophagus and the thyroid gland. While the thoracic trachea is held in place by its continuity with the cervical trachea, the larynx, and its adhesion to the esophagus and the aortic arch. Let's explore next the anatomical relations of the trachea in both its portions. First, the cervical trachea, that is in relation with the following structures. Anteriorly, to the thyroid isthmus. And further down, to the superior thyroid arteries. The inferior thyroid veins. The brachiocephalic trunk. And the thymus. Superficially, the trachea is covered by the following elements. The sternothyroid muscles. The sternohyoid muscles. And the pretracheal lamina of the cervical fascia. Posteriorly, to the anterior surface of the esophagus. Laterally, to the thyroid lobes. The common carotid arteries. And the inferior thyroid arteries. On its thoracic segment, the trachea is in relation with the following structures. Anteriorly, the aortic arch. The brachiocephalic artery. The left common carotid artery. The tracheobronchial lymph nodes. The cardiac plexus nerves. The left brachiocephalic vein. And the thymus. With the manubrium sterni. And posteriorly, it is related to the esophagus. Laterally, and on the right, it is related to the right lung and right pleura. The right brachiocephalic vein. The superior vena cava. The right vagus nerve. And the azygos vein. On the left, it is related to the aortic arch, the left common carotid artery, the left subclavian artery, and the left recurrent laryngeal nerve. Let's tackle now the vascularization, innervation, and lymphatic drainage of the trachea. Starting with the arterial vascularization. The arterial vascularization of the trachea comes from several sources. The inferior thyroid arteries. These are branches of the thyrocervical trunks, originating from the subclavian arteries. They primarily supply the cervical segment of the trachea. And also the internal thoracic arteries, that are branches of the subclavian arteries, and they provide branches to the thoracic segment of the trachea. And the bronchial arteries, that arise from the aortic arch and supply the area around the tracheal bifurcation. And the middle thyroid artery, when it exists. For the venous vascularization, the venules of the trachea drain into the inferior thyroid veins and the esophageal veins, and at the level of the bifurcation, into the azygous vein on the right side, and the superior hemiazygous vein on the left side. Concerning the lymphatic drainage, the lymphatic vessels from the mucosal and submucosal networks drain into the recurrent chain lymph nodes and the peritracheobronchial lymph nodes. Whereas the nerve fibers that supply the trachea have two sources. The vagus nerves, through the recurrent laryngeal nerves, and the sympathetic nervous system, through the cervical ganglia and the first thoracic ganglia. The second part of our video is about the anatomy of the bronchi. The bronchi are the two branches that divide from the trachea, one on the right and one on the left. They are called primary bronchi, or main bronchi. The tracheal bifurcation occurs at the level of the fifth thoracic vertebra, but it can occur lower, at the level of the T5, T6 intervertebral disc, in alignment with the sternal angle, about 1 cm from the midline. The right and left main bronchi have an asymmetrical arrangement in relation to the tracheal bifurcation. They form an angle of 70 degrees. When it comes to their segments and branches, the main bronchi present two segments: an extrapulmonary segment and an intrapulmonary segment. Let's detail the extrapulmonary segments of the bronchi. Starting with the right main bronchus. It extends from the tracheal bifurcation to the superior lobar bronchus. It is almost vertical, slightly oblique downwards and outwards. Its length is 2 to 3 cm and its diameter is 12 to 14 mm. The left main bronchus extends from the tracheal bifurcation to the superior lobar bronchus. It is almost horizontal. Its length is 5 to 6 cm and its diameter is 9 to 11 mm. The intrapulmonary segment of the main bronchus is part of the lung structure and represents the intrapulmonary part of the bronchial tree. Each main bronchus traverses the lung without discontinuity until its base. From the main bronchial trunk arise the lobar bronchi, which further divide into segmental bronchi. The right main bronchus gives rise to the superior lobar bronchus from its lateral face, the middle lobar bronchus from its anterior face, and the inferior lobar bronchus from its terminal segment. Then the superior lobar bronchus divides into three segmental bronchi for the upper lobe: the apical segmental bronchus of the upper lobe, the dorsal segmental bronchus, and the ventral segmental bronchus. And the middle lobar bronchus divides into two segmental bronchi for the middle lobe: the lateral segmental bronchus and the medial segmental bronchus. The inferior lobar bronchus divides into 5 segmental bronchi for the lower lobe: the apical segmental bronchus of the lower lobe, or Nelson's apical bronchus, the mediobasal segmental bronchus, or paracardiac segmental bronchus, the ventrobasal segmental bronchus, the laterobasal segmental bronchus, and the dorsobasal segmental bronchus, or terminal basal bronchus. On the other side, the left main bronchus gives rise to the superior lobar bronchus from its anterolateral face and ends with the inferior lobar bronchus from its terminal segment. In contrast, the left superior lobar bronchus first divides into the superior or culminal bronchus and the inferior or lingular bronchus, which further divide into 5 segmental bronchi: the apical segmental bronchus of the upper lobe, the dorsal segmental bronchus, and the ventral segmental bronchus, the cranial lingular segmental bronchus, and the caudal lingular segmental bronchus. The left inferior lobar bronchus has the same segments as the right inferior lobar bronchus. The segmental bronchi divide into subsegmental bronchi about 10 times, eventually leading to the terminal bronchioles, which end in the alveolar ducts or alveolar sac. When it comes to their external configuration, the extrapulmonary bronchi have one similar to the trachea. Inside the lung, the bronchi become circular in cross-section, with the cartilaginous rings being replaced by cartilaginous plates, which eventually disappear in bronchi of 1 mm in diameter. In terms of structure, the bronchi are composed of two layers, similar to the trachea: an internal mucus layer and an external fibromusculocartilaginous layer. Coming up, we'll examine how the bronchi are positioned in relation to the surrounding structures. Starting with the relations of the tracheal bifurcation. The tracheal bifurcation is in relation with, inferiorly, the bifurcation of the pulmonary artery, the intertracheobronchial lymph nodes, and the left atrium, covered by the oblique sinus of the pericardium. Anteriorly, the aortic arch, the right branch of the pulmonary artery, the superior vena cava, the cardiac ganglia of Risberg, and the thymus. Posteriorly, the esophagus, and the thoracic duct. Superiorly, with the arch of the azygous vein, and the aortic arch. To the right vagus nerve, the right lateral tracheobronchial lymph nodes, and to the left vagus nerve. The anatomical relations of the main bronchi with elements of the nourishing pulmonary pedicle are: on the right bronchial artery, that travels along the posterior surface of the right main bronchus. The bronchial veins, that arise from the posterior surface of the right main bronchus. The right main bronchus is also in relation to the lymph nodes that receive lymphatics from the right lung, that are the interlobar peribronchial nodes, the intertracheobronchial nodes, and the paratracheal nodes, and the bronchial nerves, that have a dual origin, sympathetic and pneumogastric, through nerve fibers from the trunk of the vagus nerve, behind the right main bronchus. And on the left, the bronchial arteries, traveling along the posterior surface of the left main bronchus. And the left bronchial veins, that arise from the posterior surface of the left main bronchus. The left main bronchus is also in relation to the lymph nodes that receive lymphatics from the left lung, that are the interlobar peribronchial nodes, the intertracheal bronchial nodes and left paratracheal nodes, and the prevascular nodes. Like the right side, it's in relation to the bronchial nerves, also having dual origin, sympathetic and vagus or pneumogastric, through nerve fibers from the trunk of the vagus nerve, behind the left main bronchus. The main bronchi are part of the functional pulmonary pedicle. They have close relations with the other elements of the pedicle, particularly the pulmonary arteries and veins. On the right pulmonary artery, running horizontally to the right and crossing the anterior surface of the right main bronchus. And the right pulmonary veins, situated in front of and below the right main bronchus. On the left pulmonary artery, that runs obliquely upward and to the left to position itself above the bronchus. And the left pulmonary veins, located anteriorly and below the main bronchus. Let's now turn our attention to the vascularization, innervation, and lymphatic drainage of the bronchi. Starting with the arterial vascularization. The right and left bronchial arteries come from the descending aorta or sometimes from the aortic arch, generally single on the right and double on the left. Concerning the venous vascularization, the right and left bronchial veins are anterior and posterior, draining into the pulmonary veins and the azygous veins. For the lymphatic drainage, the collecting trunks of the perilobular network are adjacent to the vessels and bronchi, draining into the hilar lymph nodes located at the bronchial lobar bifurcations. And when it comes to the innervation of the bronchi, the nerves of the bronchi are formed by branches of the vagus nerve and the sympathetic nervous system, particularly the cardiac plexus. With this in mind, let's move on to some clinical applications, focusing on some procedures which provide insight into both diagnostic and therapeutic aspects of airway management, such as the bronchial fibroscopy. The search for a bronchial pathology obstructing the bronchi, such as cancer, involves examining the tracheobronchial mucosa via fibroscopy. This procedure involves introducing a tube containing optical fibers through the mouth into the trachea, allowing progress into the bronchial tree. The carina forms a spur which is easy to identify, and from there, each main bronchus is explored up to its segmental divisions. A tumor nodule is localized by respecting the bronchial segmentation and can be biopsied for microscopic analysis. Another one is the tracheotomy. This is an emergency procedure that must be performed when there is an obstruction of the upper airways causing a spasm of the glottis. From a topographical perspective, a tracheotomy is performed at the following points. Lower tracheotomy, the incision is made below the isthmus of the thyroid gland. It may involve the 4th, 5th, and 6th rings of the trachea. Upper tracheotomy, the incision may involve the first 3 or 4 rings of the trachea. The isthmus of the thyroid gland is often reclined or sectioned. And cricothyroidotomy or coniotomy, also known as an intercricothyroid laryngotomy, this involves making a transverse incision at the level of the cricothyroid membrane, or elastic cone. To conclude, the trachea and bronchi are part of the lower respiratory tract. They allow the passage of oxygen-rich air from the larynx to the lungs, while filtering the air to improve its quality and facilitating the elimination of carbon dioxide-rich air expelled by the lungs. Knowledge of their anatomy is essential as it allows for an appropriate diagnostic and therapeutic approach.